So we are chatting to Sister Julia McGhee today. Julia, thank you so much for agreeing to join us in this little series where we would like all of our followers to just get a little sense of who the providers are on our network and get to know them better. So to start us off, would you mind maybe just letting us know who you are? You can introduce yourself, let us know who you are, what your nursing journey has maybe been, and how you first got interested in palliative care.
Yes, thank you. And thanks for this opportunity. So I got a BSc in nursing from Wits a long time ago, possibly before you were born, but we won't go into that. Um, and then I'm registered as a general nurse, midwife, psychiatric nurse, community health nurse. And I've also done a certificate in palliative nursing. But I've spent the bulk of my career, over 30 years, actually in clinical research, managing and monitoring clinical trials. And I ran an early phase clinical trial unit. And then I ended up in business development, writing proposals for our pharmaceutical company clients. But I always wanted to get back to nursing and, more hands-on nursing. And my dream was to provide holistic nursing care to people in the community. And this was almost 4 years ago, and fortunately, Aligned and I connected, and I haven't looked back since.
Wow, thank you so much for sharing. I must say, I did not know a lot about what you did before I started engaging with you at Aligned. There's an array of experience and knowledge. So yeah, it just shows what these sessions can do. We learn so much about, the people that we actually engage with on a regular basis. So thank you for
Mm.
sharing that with us. Yeah, so you said, I mean, it's almost 4 years now that you are part of the Alive Network. And I mean, it goes without saying, we're very grateful to be working with you, having you support our patients. But yeah, maybe if you can tell me a little bit about when you first joined Aligned, how it kind of changed the environment you were working in, how it changed your practice in terms of referrals, or just any kind of support that you've experienced.
Hmm. So I think that the biggest change for my practice was to become part of a multidisciplinary team. Um, and that's been invaluable in terms of support of me in my role as a palliative care nurse, and learning from other very experienced palliative care professionals. And typically nurses don't work in multidisciplinary teams. So this was a new thing, and it was a good change for the practice. Um, so the referral system is also great, and especially in the beginning, because it gave a jump start to my palliative care practice. In that, referrals were coming through. I wasn't spending a huge amount of time looking for referrals, which nurses usually have to do. Of course, we develop relationships and we look for referrals as we go along. But in the beginning, it's particularly nice to have referrals coming to you. And also the fact that they pre-authorized for a benefit with the medical aids. I mean, that's invaluable. Otherwise, it's lots of authorizations and motivations and admin on our parts. And that's taken away from us. So that was also a big benefit. In terms of support from Aligned, I mean, the support is great. I have to say we don't get it from any other medical scheme structures to the same extent. and particularly having a care partner assigned or dedicated to each patient and their family um, helps us a lot. Um, because we then also, we can just, if we identify that the patient needs a hospital bed, for example, or oxygen, to be able to just put a note on Huku, which is a great communication platform that you offer, um, to just put a note on there and the care partner sorts it out is wonderful. And the patients and families and the providers um, all benefit from that support, and that is unique to Aligned, and it's great.
Hmm. Thank you so much for sharing that experience. I mean, it really kind of hits home and closes that circle for us, because we try to support our providers as much as possible, but we don't really understand what are all kind of the things that come into play when you're doing the practical work on the ground. It's not just the
Mm,
clinical work of supporting your patient. Like you said,
mm,
it is getting authorization or making sure your claim gets paid or talking to another provider. So it's really valuable for us hearing this feedback from you as well, in terms of what we think is best practice to put down operationally, but actually to hear that feedback from you of how it's working in real time on the ground in your practice. It's really
mm.
beneficial. So thank you for the compliment as well. We'll pass it on to our care partners, definitely. But yeah, I mean, we appreciate the feedback from you as well in terms of what works operationally and what doesn't. So thank you for sharing.
Mm. I think if I can just add to that,
Hmm.
um, being in private practice is very different to being an employee in a hospital, for example. Um, when you're employed, your only job is clinical work, and maybe and some admin documenting your notes as you care for your patients, which obviously we do as well. But you aren't aware of the administrative work in private practice until you're in it. So to have assistance with that is great.
Wonderful. Thank you for sharing. So we offer a primarily home-based palliative care program. Do you maybe want to talk about how you feel, in your opinion or in your experience, what difference home-based palliative care actually makes or contributes to patients, to their lives and to the lives of their family as well?
Mm. So, um, there are lots of things I could say about that, but I and we do get some feedback from patients and families. I mean, you as Aligned ask for that feedback, but I received a letter from the daughter of a patient, and if I may just read from part of that
Yes.
letter, because that just it it explains the difference that it can make. So
Yeah,
I'm
absolutely.
just going to read from that.
Wonderful.
Um, Okay, so she said, we're so fortunate and so privileged to have been assigned to you and your team and list of patients needing care. You and the doctors and the social workers, and I've just left their names out, but the team made my mum's last days on this earth as comfortable and pain-free as possible. And for that, my family and I cannot thank you enough. We were able to grant Mum her last wish of being at home. And thanks to you all, you helped to make it possible.
Wow.
I
I
think
mean,
that
you're
just
absolutely
nicely
right.
summarizes what we do, or what we did for that patient.
Absolutely. Yeah. I mean, how amazing that the work you do doesn't only benefit the patient as an individual in the circumstance, but I mean, as we can hear, an entire family benefits from receiving the support. Um,
Mm.
Thank you so much for sharing that with us.
Mm.
Yeah.
Yeah.
Okay, then I think maybe just to end us off, what would you say to other nurses or even other healthcare professionals that, maybe starting out a practice or maybe interested in exploring, getting further into palliative care? Yeah, what would you say to them, or what words of wisdom would you like to impart?
Mm. Um, so, so in my practice, we're 4 nurses in our practice now. And we were chatting about it the other day, and we all feel that this is the most meaningful work that we have done, meaningful for ourselves. We always hope our work is meaningful for patients and their families, but it's really been fulfilling and the most meaningful work we've ever done as nurses. Um, and so it's that aspect, which is obviously the goal. But the other benefit is particularly for nurses, and I know for social workers as well, is that in palliative care, in the multidisciplinary team, we are all considered equal members, equal contributors. We all have our part to do, and we're all valued for the role that we each play. And that is particularly meaningful because you often get situations, especially with nurses, where there's more of a hierarchy, and nurses just follow orders. But this encourages us and allows us to be critical thinkers, and give meaningful impact, input into a patient's care. So, I mean, those have been some of the benefits. But if I was to say to a nurse who's considering going into palliative care, um, it's not an easy job. I have to say that, but because of the team, because of organizations like Aligned, there is support. So it is possible. And also, as a nurse, seriously consider getting a specialized training certification in palliative nursing. It's absolutely invaluable. It enables you to be to provide your patient with better care, to be more uh, recognized, in your team, because you can provide better input into the team. And with palliative care, you don't know what you don't know until you've learned it. So that would really be my advice.
Hmm. Wow. Thank you so much. Yeah, I mean, such valuable information. I mean, not only in terms of supporting patients and like you said, that meaningful work that you're getting back as an individual, but some great practical tips and experience as well. So, yeah, thank you so much for sharing. Hopefully, your words will land well with any new providers that are interested in joining. Um, but yeah, I just want to thank you again for taking the time to sit down with us today. Like I said, I've already learned so much about you, even though I've engaged with you on so many different occasions before. I just want to say again to you that we are so grateful for having you on our network and grateful for the support that you do give to a lot of Aligned patients. Yeah, and we look forward to all of the future work that we get to do together.
Oh, well, thank you. Thank you for being there and being a partner in our practice, because it makes a huge difference. So we're very grateful to Aligned as well. It's a great collaboration.
Wonderful. Thank you so much for sharing.